Assalamu alaikum. I am Muhammad Tareq, ophthalmology resident from Al Imamain Al Kadhimain Medical City, and today I am going to talk about integrating clinical and imaging data for the predicting of glaucoma visual field progression with the help of artificial intelligence. So we all know that glaucoma can cause progressive visual field loss, and that may lead to irreversible blindness. So early detection of this progression is crucial in order to preserve vision. And we know there are multiple metrics that can be used to assess this progression. These include pointwise linear regression, mean deviation, and other metrics that can assess the changes in visual field sensitivity over time. And the artificial intelligence can help us to predict this progression through integration of clinical and imaging data at the same time. So what is the meaning of multimodal? As a human, we rely on our eyes to see, we rely on our ears to hear, and we can read. And at the same time, our brain can combine all these together and provide an interpretation. Similarly, the artificial intelligence can do the same job. It can look at genetic data, it can look at pathological data, it can look at imaging like CT scan and MRI, and combine them together through a complex mathematics and provide an interpretation. And in our field, glaucoma, the AI can help us in the same manner, looking at the clinical, like the age, the gender, the intraocular pressure, the central corneal thickness. It also can look at imaging, like the fundus photography with focusing on the optic nerve head. We can also use the visual field data, the OCT with its parameters, in order to predict the glaucoma progression. So the objective of this study was to use artificial intelligence, combining different modalities, the clinical and imaging, in order to predict the progression of glaucoma by predicting the pointwise linear regression 2 and 3 and mean deviation. We also wanted to predict the visual field sensitivity over the next visit, and we will use the fundus photography image to predict the real RNFL thickness, the retinal nerve fiber layer thickness. So the data set used is called GRAPE. It includes multimodal data, clinical and fundus photographs. It included 144 patients with 263 eyes, and the total number of records with their follow-up visits include 1,115. It includes only adult patient 18 to 81 years. So the data set, as I said, included clinical data and parameters of progression. This is the training. And now going for the results. The mean age of our sample was 41.5 years old. Equal male and female were included in this study. The mean intraocular pressure was 17. The mean central corneal thickness was 534. About 85 to 95% of the samples over 1 year follow-up were non-progressor, and the mean retinal nerve fiber layer thickness was 79. So going for the first task, we use AI to predict the visual field in the next visit. The sensitivity in the term of decibel for each point. And as we can see on the left of the screen, this is the current visual field, and on the right, the next visual field data over 6 months to 1 year. And if we want to look at the metrics and how accurate the AI was in that task, the mean error in the prediction of the sensitivity was 2.5. And you can look at the figure on the left with a perfect red line and high correlation between the true value and the predicted one. So it was very accurate for this task. For the second one, we used the fundus photo to predict the thickness of retinal nerve fiber layer. And similarly, the performance was very high, and the mean error in the prediction of the fiber thickness was 8 micrometer. So this is the way the AI look at the fundus and they try to predict the thickness of the RNFL just from the fundus photos. And our final task was to predict whether an individual is going to have visual field progression over 1 year or not. So as you can see, we combine the fundus photos, 3 visual field visits data, and the clinical parameters. And we wanted to predict the progression with the PLR2 and 3 and the mean deviation. And as we can see, it had an accuracy ranging from 78% up to 83% in detecting patients who are going to develop visual field progression over that time. And in conclusion, we can find that the AI can help us in different glaucoma tasks. We can use it to predict the RNFL thickness and predict the next visual field sensitivity point, as well as whether the individual is going to have glaucoma progression or not. And finally, you can try it yourself. Use your mobile phone, scan this QR code, and try our application. Providing fundus photo, you can predict the RNFL thickness. Use it right now, and thank you.